Great. Welcome everyone to our November event for the NGO Committee on the Family New York. We are thrilled to offer the event Families Coping with COVID, Challenges and Opportunities in Child Welfare. I just want to take a moment to, of course, welcome all of you as attendees from across the world. We're appreciative that you've taken the time to be with us today to discuss this such an important and essential topic. I also want to point out the membership of the EC Committee for the NGO Committee on the Family. I am one of the co-chairs of the NGO Committee on the Family New York. My fellow co-chair is not able to be with us today, Ryan Coe. We also have the treasurer, Vinnie Santoro, our corresponding secretary, Nadia Wolf, our recording secretary, Lynn Walsh, our member at large, Florence Denmark, and our member at large, Marilyn Kanelski. So thank you all for being with us. We certainly couldn't hold these events without a great EC representation. For today's event, I'm thrilled to have three excellent speakers for the event. And before we get to that, I just wanted to briefly kind of lay out what the role of the NGO Committee on the Family New York is. We focus on advocating for the inclusion of the family in international resolutions and policies at the UN, educating the public on international issues and policies affecting the family, promoting the well-being of children and parents in the extended family, and supporting communities' role in strengthening the family. And today's event will certainly move us in the direction of how do we think about supporting families, and how do we think about families in a more inclusive way, so that we're thinking about how do we support families rather than how do we surveil families, and how do we best find ways to support those parents, children, in the intergenerational family. So with that, today we have an excellent event. Our first speaker will be Professor Jane Spinak. Professor Spinak is the Edward Ross Aronow Clinical Professor of Law at Columbia University. She's a renowned advocate for children's welfare and juvenile justice, co-founded Columbia's law clinics focused on representing families and children, and currently directs the Adolescent Representation Clinic, which represents teenagers and young adults aging out of foster care. Her scholarship focuses on the history and effectiveness of the family court, and she presents this information to child advocates, lawyers, judges, and for trainings to lawyers, social work, and workers and mental health professionals. Additionally, she's a member of the New York State Permanent Judicial Commission on Justice for Children and serves on the Mayor's Advisory Committee on the Judiciary. She's the founding board chair of the Center for Family Representation and Advocacy and Policy organization dedicated to ensuring the rights of parents in child welfare proceedings. So we're honored to have Professor Spinak with us here today. For effort of time, I will also introduce our additional two speakers who will go in this order. Our additional two speakers come from the organization RISE. RISE was founded in 2005 and is led by parents impacted by the child welfare system. RISE believes that parents have the answers for their families and communities, and their mission is to support parents' leadership to dismantle the current child welfare system, eliminate cycles of harm, surveillance, and punishment, and create communities that invest in families and offer collective care, healing, and support. Representing RISE today are Jeanette Vega. Jeanette is the training director and assistant director at RISE. She graduated from the Child Welfare Organizing Project's Parent Leadership Training back in 2005 and was one of the first parent advocates to staff child safety conferences in New York City. Jeanette has worked as a parent advocate at Episcopal Social Services and is also certified as a visiting coach and host. Jeanette's passion and dedication to this work and organization comes from wanting all parents to be the lead voice in changing systems and building community power. Parents know what parents need, and mentions that she's a proud wife and mother of 4 excellent boys. And Jane, I apologize that I didn't ask you your information about your family, so maybe you can fill us in on that when you start. And our final speaker will be Imani Worthy. Imani is a parent leader at RISE and facilitates workshops on public speaking for the Rise and Shine Parent Leadership Program. and core parent advocate training. Ms. Worthy recently spoke at a New York City City Council General Welfare Committee hearing on racial disparities in child welfare. So welcome to each of you, and we will move forward with our first speaker, Professor Spinak.
Thanks, Ben, and thanks to the committee for inviting me. If it's okay, I'm happy to be here with Jeanette and Imani and hope we can all be on a first name basis for today. In planning today, we talked about a couple of themes, so I just want to put them out there, and then I'm going to do a little background and overview, and then Jeanette and Imani are going to talk much more about what's going on right now on the ground. So the first theme we talked about, and it made me think about how I teach my students about the theory of the case. If you can get it down to a few words, then you've really got something to talk about. And those few words are supporting and not reporting. So really rethinking how we support families and not just how we survey them and report on them. And that's all families, but especially BIPOC families who are most likely to be involved in what we call now the child welfare system. Many of us are beginning to call it the family regulation system because we think that that more closely reflects actually what's going on, at least now. The second theme is how we've seen this COVID divide, how even though we all know that there are great disparities and inequities and inequalities in the United States, I think that COVID has made it much more clear to many more people about those disparities. I hope that will result in them being increasingly understanding of families that are under stress and don't have the kinds of resources that many of us are fortunate to have that helps us get through this time. And then the last theme seems to be, you know, what do we learn from this and how do we move forward and how do we use the knowledge we've gained from this terrible time to do some things differently. So I'm going to start with a little bit of an overview to give you some background for those themes. So I'm going to start in the early 1990s when the US Advisory Board on Abuse and Neglect called our child protection system a national nightmare. So this is not today, this is in the very early 90s. And their point then, you know, this is a national advisory group that is required by the federal government to exist under federal law. And what they were saying then is that we needed to shift from reporting families and sending them through an extensive investigation process and court proceedings to shift instead to develop community-based, neighborhood-supported assistance and services for most of the families who find themselves involved in the child welfare system. Unfortunately, nobody listened to them, even though they're a national advisory committee. They weren't listened to, and instead, when the Clinton administration came in, their response was the Adoption and Safe Families Act, which remains currently the law. The key law on child protection and foster care and adoption in this country. And the thing about ASFA, as we call it, is that it was intended to increase permanency and safety for children. But in fact, it really didn't improve the lives of children, and it has severely disrupted families. So that's in part because the reporting system that existed then remained in place. And the concept of permanency was really focused on adoption and not on reunification of families. So, so following ASFA, there was actually a significant decrease in the number of families reunified, and there was a great increase in the number of adoptions. Some of that was, the part of that was good was that there were many children who had lingered a long time in foster care who couldn't go home and were adopted. But for many families where reunification could have taken place, it didn't. And instead there were adoptions, many of which unfortunately did not remain in place. We have now an entire system of broken adoptions in the United States. And it's interesting, there's a Professor Mark Testa who really blames that on our thinking that legally binding connections were the best thing. And when he says what we should have been focusing on is psychological lasting connections, not thinking that the legal answer had to be adoption, but rather how do we find a way in which to make sure children are connected to adults, hopefully their parents or their relatives, who have a long-term commitment to them. So I think that part of the reason why we held on to the system we did is because we have this, we have, I think, in my mind, a wrongly understood connection between what most families need and the continuing idea that we need to report on those families. When reporting began, it was based on the work of Dr. Henry Kemp, who had identified that there are a small percentage of children who are seriously abused or neglected, and we need to pay attention to those children. What we did instead was, and this was not his intention, we created a reporting system for anything that might go wrong with a family. And so we drew into what is our child protection system, many more families that don't belong there. So I'm just going to give you the data from 2018 so you can see how what I'm talking about. So in 2018, 4.3 million children were reported across the country. Almost immediately, half of them were screened out. So you had families, 2 million families disrupted by this reporting that for the most part provided them with no assistance and disrupted their lives because they were being investigated. Of the ones that were left, only about 700,000 of them were even identified as substantiated. That is, something's going on that we are concerned about and need to look at more carefully. But even then, only about a quarter of the children who are part of substantiated accounts ended up with any court action whatsoever. So we went from 4.3 million children being reported to, or 4.3 million reports, to about 170,000 children who may end up with some kind of a finding of maltreatment. So you can see we're spending our resources in exactly the wrong place. If we could identify that much smaller number and then figure out how do we maximize our assistance to them, that would be a very different system. And of course, that was the system that the US board recommended, in the early 90s, that we did not adopt. So I want to talk for a moment about what I see as the difference between an ideal system and a possible system, and then some of the lessons that I think we've learned from COVID. So ideally, we should have universal supports for families, right? So we can significantly reduce poverty, because the correlation most clear in child welfare is between poverty and child protection. We already know that, and that has been proven, I would say, in many different ways through many different studies. We also need basic health care, basic child care, improved schools and community activities. And we need so much of that to be developed by the communities themselves. Community-led, community-developed, so that the families involved can trust the system. We're not going to get that here yet, that ideal system. So then we have to think, all right, so what's possible? And I do think that what we've learned from COVID is that we can see areas that we can deal with much more immediately. We learned from this experience that the tech divide is as divided as everything else, and that if we're going to develop a system that really supports low-income families who are involved in the child welfare system, we're going to really need to think about how to change that. In part, so some of the lessons that we've learned from this COVID period can be used, like virtual visits. Even though, we don't want children just visiting virtually. Imagine what it would be like if every night a parent could call and read a story to a child before they go to sleep. So we can learn some things from the virtual world we've been in that we can use going forward. We also have a much better understanding of the stress and dislocation that so many of us have experienced, that we can say, so how do we use this for families who are most impacted? I think it will actually improve our empathy level in a way that has not, there are wide swaths of the population who just don't know anything about this system, but even those who do don't necessarily have not necessarily had the empathy they've needed in order to understand what families, particularly low-income families, BIPOC families who are involved in the child welfare system, really have to deal with. I think we're going to have lessons from the drop in reporting that occurred, and we can start to figure out, okay, was that drop because children who were at risk of maltreatment weren't being reported, or is it that the noise went away? The reports that didn't need to happen didn't happen. And so maybe we can rethink and reduce that reporting system. I think we learned something from the stimulus checks that went out that gave more income to low-income families, and from the hiatus on evictions and the loosening of requirements on the provision of health insurance, so that we can see, okay, how did those make a difference, and how might that be used in the child welfare system for having more flexibility for families. And as I said before, I think we're going to be able to learn from what we've had to do remotely that works. So, more frequent visits, even if they're not all in person. What can we learn from virtual court proceedings? And I hope that Imani and Jeanette are going to be able to talk about the experiences that parent-involved RISE members have experienced. But, court proceedings are so disruptive for so many families. Can some of that be done virtually, so you don't have to spend a whole day, you spend an hour? Not always, because sometimes being there is very important, but often it's not. And just checking in with the court for a half an hour proceeding might be a great benefit for parents who are involved in the system, not having to miss work, not having to miss appointments that are crucial for their families. So I think there are lots of things that we can learn from this, and I'm hoping that after Jeanette and Imani talk, we'll be able to have a little discussion about what are some ideas that we all might have for doing this.
Great, thank you so much, Jane. That's terrific. The history and the context are so important in thinking about what it is that we're getting from reporting, and is that protecting children in the way that we think it is? I think many people, when COVID first happened and saw the low reporting numbers, thought that was a horrible thing, and it could be, but it also could be what you're pointing out, that it's less meaningful, and reports that would go unsubstantiated are getting, not being recognized and being reported, and are protecting more families in a meaningful way, in a beneficial way. So we will now move forward to hear from Jeanette Vega, Assistant Director of Training and Policy at RISE.
Hi, good afternoon, everyone. I know you guys have a split up for me to talk and then Imani talk, but we're actually like a combination of talk. So I will talk and then Imani will talk and then I will come back and talk, if that's okay with you guys. We have a little process.
Certainly, that sounds perfect.
So good afternoon, everyone. Thank you for having us here today. My name is Jeanette Vega. Thank you for the introduction. I'm the Assistant Director for Training and Policy, and with me today, as introduced, is Imani Worthy, our brand new parent leader at RISE. So we are excited to have her on our team. Founded in 2005 and led by parents impacted by the child welfare system, RISE believes that parents have the answers for their families and communities. Our mission is to support parents for their families. Our mission is to support parent leadership to dismantle the current child welfare system, eliminate cycles of harm, surveillance, and punishment, and create communities that invest in families and offer collective care, healing, and support. We envision communities that are free from injustice, family regulation, and separation, and a society that is cultivating new ways of preventing and addressing harm. We at RISE, we imagine a radical new commitment to ensuring that all families have what they need to live beyond survival and actually are able to thrive. Each year, RISE works with hundreds of parents in New York City to document their experiences with child welfare, inform parents of their rights. We also train parent advocates to support parents in navigating community support or their child welfare involvement, and advocate and organize for community investments for law, policy, and practice to change to reduce the reach and harm that child welfare is causing our communities.
I recently read an article in the Daily News that was titled, "Bronx Grandfather Who Took Dying Girl on 2-Hour Ride to Queens Hospital Charged with Child Endangerment. Victim's family says he didn't mean no harm." The story is about a 3-year-old girl who fell ill while at her best friend's sleepover. The best friend's grandfather, Anthony Richardson, panicked and took the toddler to his family doctor in Queens. Authorities who arrested and charged the grandfather with child endangerment claims that he could have simply taken the young girl to a medical center less than a mile away from his home, which was in the Bronx. At first thought, you may agree with the authorities, but I can relate to this grandfather and the decision that he made. Rather than demonize him for his actions, we should all be asking why he didn't decide to go all the way. Why did he decide to go all the way to Queens instead of taking his child to the hospital in his neighborhood? The truth is, his local hospital, like many in the Bronx, has the reputation of not only providing low quality care, but also for being a part of a system that police and punishes people and families who are seeking support. Stories like that of Anthony Richardson are sensationalized in the media to make the public believe that children are at a greater risk of abuse because of the pandemic. In June, the Marshall Project reported that dozens of headlines suggested that child abuse cases would surge because mandated reporters, teachers, doctors, social workers, would not be able to keep an eye on vulnerable children, thanks to stay-at-home orders and social distancing. This created a public panic that many child welfare experts said would only increase policing on Black and brown families. While the public was made to worry about children being isolated and abused, experts say that up to 90% of previous reports made by teachers were not substantiated, proving that mandated reporters often made unnecessary calls on families who are facing issues because of poverty and neglect. When COVID-19 started affecting more and more people across the world, it seemed like all of a sudden there was this huge shock about what it's like to live in poverty in America. Some of us were already going to food pantries because we didn't make enough money to provide and feed our families. Others were already facing evictions even before the market crashed. They might have already been having employment issues. Life was already happening for a lot of us, but that was overlooked. We were villainized, labeled as welfare queens, lazy, neglectful, and inefficient. Parents are always being faced with difficulties when it comes to what we think is best for our families. COVID-19 has not created new issues. It only highlighted the ones that people of color living in low-income communities face daily. At RISE, parents have written about how COVID has impacted their already limited social support. One parent, Melissa, wrote, "I'm financially struggling because this came unexpectedly and I have no money saved up. I struggle with food and I'm not getting any extra help from welfare. It is hard for parents and single mothers who have very young kids and have to spend money on expensive things like diapers and milk. The situation is impacting my housing too. I put in a transfer to move into a new apartment because of COVID-19. Nothing is moving forward. Housing has closed down in-person meetings or anything with the management office. Work orders are delayed. I have to wait for them to repair my sink. It's been leaking for a while. Although I have a support system, that doesn't mean they can support me at this time. They are facing their own personal problems with coronavirus. Still, I can recall a few times when I felt supported through this pandemic, like when my brother came to watch the kids to give me a break to go food shopping.
As you guys heard from Imani say, the parents that we work with at RISE are Black and Brown parents living in low-income communities. These are parents who have been accused of child abuse, but in reality are guilty of poverty. Parents who reach out for help and instead get a hotline call and an investigation from the people that they trusted during hard times in their families are the same people calling in child welfare cases on us. In our communities, schools, parks, sports, and art programs for children, mental health supports for families, affordable and safe housing, crisis services are often inaccessible or low quality. Yet rather than target community conditions, the child welfare system targets individual families. Too often, the support that are available to low-income families comes with strings attached. The strings of surveillance, of loss of control, of punishment, of harm. Parents who need help for their children, like services to address school challenges, a winter coat, or just a box of food, know that every request for assistance can put their family at risk of an investigation and even family separation when they're just in need. ACS has recently expanded programs intended to approach families more compassionately. Although in some ways this may seem like reasons to applaud them, but we know that these programs still represent an investment in ACS, not an investment in community-led and community accountable organizations that parents actually say they trust to support them and their families. These programs have been created with good intentions, but with a fatal flaw: their affiliation with an agency that strikes fear in families' hearts. And let's not forget that a lot of these things are being created without the feedback of the community of what we think we need. It is clear that parents do not want to receive support or resources through ACS affiliated programs. Preventive agency staff report that they spend months engaging parents who want support in their families' lives through this pandemic, but these families are fearful and distrustful because they are affiliated with ACS. In fact, at the beginning of this pandemic, parents were only assessing 40% of services offered through ACS, which we all know way more families were in need. Similar to New York City, countries like England and Finland have also seen an increase in child welfare cases, as funding that would protect vulnerable families' social safety net has decreased. In collaboration with the International Parent Advocacy Network, RISE has created a toolkit for transformation that calls for a parent-led movement for reforming and dismantling this child welfare system. Globally, parents and advocates are calling for abolition of the child welfare system. We know from personal experiences that the current child welfare system does not work, and simply calling for reform of the system will not work either. We are seeking to address the pain, fear, and hurt that people are carrying from a place of compassion, care, and humanity. We can look to the ways of prison and police abolition is connecting to abolition of the child welfare system. As Dorothy Roberts says, abolition policing also means abolition family regulation. And Ruth Wilson Gilmore reminds us, abolition requires that we change one thing, and that is everything.
Parents raising children under the double burden of economic hardship and racism should not have to live in unprecedented scrutiny of our parenting. Families under stress need opportunities to decompress. We need safe places for our children. We need opportunities to develop strong relationships with other parents. We need outlets from isolation and stress. When COVID-19 created additional struggles for our families, we saw that community-based organizations, not the family regulation system, stretch their resources and create new opportunities to connect with and support families. Part of our work at RISE included sharing a newsletter to parents where we highlighted different community groups and resources for them to go to. For more information, you can check it out on our website at risemagazine.org, and we will also share a link for that in the chat box. To truly support low-income families of color, New York City and other places across the world must reduce the footprint of the Child Welfare Service and channel funding to trusted community-based organizations that can assist families, prevent and address harm without the terror of system involvement, and support community healing so that all families in New York City have the opportunity to thrive. Thank you.
Thank you guys so much for listening to our parent perspective of how COVID is not something new, but something that people are now starting to care about, the situations and the community environments that families are going through. As we said, it's not nothing new. COVID is just bringing a higher awareness to it. And I hope that we can remember, even when COVID finishes, we need to remember our families in these communities. Thank you guys so much for listening to us.
Great. Thank you so much, Jeanette and Imani. Those were wonderful words and perspectives on what the flaws are in the system and how we can think about interacting with the system and rethinking the system entirely to better serve all parents and families and children. So I now want to open us up to question and answers, but as is often the case, I, as the moderator, have a little bit of power and I get to wield it now. So I'd like to offer the first question to Renata Kazmarska, Social Affairs Officer and Focal Point on the Family, located in the Division for Inclusive Social Development in the Department of Economic and Social Affairs at the United Nations Secretariat in New York. So Renata, thank you so much for joining us, for always supporting the NGO Committee on the Family New York. The floor is yours. You're on mute still, Renata, sorry.
No matter how many times I use Zoom, I always do that. Thank you so much, Ben. And I wanted to thank the committee for organizing events like this and raising awareness of these important issues that are often invisible, and we really need to talk about them more and find solutions. So when I listen to the speakers, I realize that this is quite a global issue. It's not a national issue. I hear from parents that when everything is fine, right, the families are taken for granted, right? So yeah, this is a normal state of affairs. When something happens, right, the families are blamed. And the thing is, the families have so many functions, and these functions are just go on unsupported. So no wonder if there's if something goes wrong, oh, it's the parent's fault, right? So I hear that I hear critiques of this from many countries, many regions, and it just always surprises me how we got to this point. So my first question is, probably Jane would answer it. How did we, how did this evolve? How did this happen? That the we started reporting on families instead of helping them. Is this the fault of the bureaucratic systems, the changing perception of families? How did we arrive here? And then, if this is an approach that any government takes, that this is a way to go, the punishment is the way to go, how do we reverse this? Because this is kind of a mindset, I suppose. This is not, and probably this mindset also impacts on public opinion. So when we decide on the budget, right, who do we support first? We often, for example, we often talk about child poverty. You mentioned that you mentioned the abolition of a child welfare, which kind of resonates with me, because when I hear child poverty, I'm thinking, well, except maybe for street children or homeless children, maybe abandoned children, this is not really about child poverty. It's about family poverty. So we need to target families to really get rid of child poverty. My question is, how did we get here, and what do you think are the best solutions? I understand you mentioned channeling funding for community organizations. How how do we approach this? How do we work with the local government to influence? At which level do we make this meaningful change? How do we approach this practically? My question. Thanks.
Well, that's a big question. But I guess I want to start by picking up on what Imani and Jeanette said, at least in the States, and I don't know necessarily around the world. This system is both a racist system. It has historically been. Certainly the formal child welfare system initially was focused on assimilating poor immigrants to make them into Americans, and then shifted its focus on particularly BIPOC families in poverty. And so, you know, how do you fix it is really hard. As Jeanette said, we need to stop the system in the way that it is and rethink the way in which we engage families. So, as I said in my remarks, I mean, part of it is at least in the States, you know, how do we change our thinking about what all families need, whether it's a basic income, good health care, good treatment provision, good child care. All that would do a lot to just eliminate most of the issues that low-income families who may be in crisis need. I think that the more so I think that would go a great deal, but we'd have to change an awful lot in this country to get there. So what's possible? I mean, I do think what's possible is some of what's occurring. Certainly the development of family-involved voices like you're hearing today in New York has made a huge difference in how we think about what families need, because we're actually listening much more to family voices to say, here's what we need. And I also thought the point about the fear of engaging in supports that come along with surveillance, which is what happens in the child protection system, is one of those things that could change. If we shifted our resources to community-based organizations and don't ask them to report on all of these families the minute something goes wrong, or there's a concern, as opposed to engaging with the families when there's a concern, I think that would significantly reduce the number of families who have to go through this really oppressive system. And last thing, and then I'll let the others speak as well. I think that the last thing is we have to recognize that there are a small number of families who need some intervention that is heightened intervention, because there is so much going on that these universal supports are not enough. And I think whether that has to be through this same system, I'm not convinced, though there are some extreme cases that need to be dealt with legally. But it's understanding, again, that this is a very small number. and that what we need to work on is the vast majority of families who need basic supports so that they don't find themselves moving through this system.
Yeah, and I'll just add quickly, I mean, I thought that was on point, Jane. I would add that at RISE, we've been thinking and working on a project, me and Imani and the rest of the team, to really think about what does peer advocacy look like, especially in New York City, because you're right, like as a parent, I want my support from another parent who has similar experiences in the situations that I've been in, because once it gives you comfort, it gives you hope that if other person overcame their obstacles, so can you. So we're really thinking at RISE, how do we create peer advocacy, even if it's on, we would hope they get jobs, right? But we're definitely starting it as a volunteer basis, because when you do something from the passion of your heart to support other people, it reflects and it empowers other parents. Our goal is to give parents information so that they can self-determine their own lives, have resources to de-escalate anything that may be happening so that it doesn't become a crisis. And another thing important that we think at RISE is that mandated reporters, a lot of mandated reporters are just making calls. And like Imani and Jane both highlighted, right now we've hear in the media that there's less reports because our kids are not in school. Our kids are safe at home. And I think because the mandated reporters don't have access to our children, they're making less calls, but the families are actually thriving with the craziness that's happening through COVID, being teachers, being parents, working full time. You know, it's been a lot. And I think when you hear that in the media, it portrays that kids are still being hurt on the silence, but that's not the reality that we're seeing, especially in New York. Parents are busting their butts to make sure that their kids get their education, that they're still working, that they're thriving in their family. So I think a big part of it is really bringing awareness to mandated reporters, especially in the Department of Education, to highlight you are here as a public support and resource to these families, not just to teach our kids from 8 to 2, but if a problem arises, you should be a support for this family. You should not be thinking risk and call State Central Registry without understanding, one, what are the traumatic and stressful things that come with that SCR call when you call the State Central Registry on families, and what can you do as a community to support, right? Like you have parent coordinators. Can we hire a parent advocate to work with the parent coordinator in the school, because we're saving a whole lot of money just hiring someone to be in the school, to be in charge of community resources within those districts, getting our district leaders involved in the need for what our families need within their schools and their districts, so that they can also implement and bring awareness to these real life challenges that do not need child welfare intervention. They just need community support. And how can we start building things that really reflect that?
Imani, did you want to add anything? I know you and Jeanette work so closely together. It may be that you all have the same thoughts, but any thoughts?
Yeah, I actually, I connected a lot with what Jane was saying. In my head, I was like, the orphan trains. Girl, we can start, like, started with the orphan trains. And then it started, we can talk about that all day. But thank you so much for acknowledging that. And like Jeanette said, we are all, RISE actually had an article recently that I read about surveillance and mandated reporters. Like they're not trained on how to identify what neglect and abuse is. So with that being said, and to be frank, a lot of the teachers in our public school don't look like me. They don't look like our kids. They come from different environments, different cultures. So they might see us, I might be a strong personality that might be intimidating. And then look, we have some kind of miscommunication, right? We have a rift there. So a lot of it deals with like not understanding biases, cultural biases. I think that I personally believe that I don't believe there should be ACS. It should be based more on family preservation, not on just focusing on one part of the family. You need to protect the kids and protect the kids, right? But there should also be something in place that is going to be preserving the complete family dynamic, and that's respectful. that's my 2 cents.
I would just add, when you say protect our children, I think that's ACS's big motto. Like, we're here to protect children, but the reality is that you're traumatizing our children when you don't support the parent to protect the child, right? So like, how do we keep that connection to a family support versus just protecting our children?
I just want to add one thing, which is that a problem of the mandated reporting system that we haven't talked about is that many people who call in reports think they're calling in to help. They don't realize that this is not the way to get help. And so it shifts the responsibility. Oh, I have to do something, so I'll call, as opposed to, oh, I have to do something, so I'm going to figure out with this family what's going on so I can figure out how to help. And that's a real problem, is that people think they're helping when they call, and they rarely are.
Great point. Yeah. So we've got a question in the chat about how the current child welfare system may be inadvertently further impacting fathers in the family dynamic, and whether any of you can speak to whether what would be needed for a system that would engage fathers to be more present in their child's life, and of course mothers as well, right? How do we get parents more engaged? But as the question's pointing out, the system may be kind of exponentially impacting fathers' involvement in their child's life. So would any of you, Jeanette, maybe?
Yeah, I was gonna just like jump in. I was like, I definitely agree. I think fathers are discriminated against. I think when you see a big Black man come into an agency with tattoos, it scares them. They don't know how to react. I think what Imani is on point, right? Imani said culture. I think when people see the presence of a strong Black man, and when you have your tattoos, they portray you to be some kind of person. They don't call fathers. They don't acknowledge fathers as being a resource for our children. Sometimes if they're not on the birth certificate, they give them hell to just prove that they're the father, even though the mother is saying he's the father. I think they give fathers so much of a runaround that the reality in our culture is that when too much is too much, we kind of just move back and say, like, we're just not going to deal with it. And I think the child welfare system puts father in a situation where they just don't want to be bothered with the system. They give them too many hoops to jump, and they don't think of a man's pride, right? Or their ego or their presence. And I think that is so important to really include fathers in our children's lives, because I say it all the time. I might, even if I hate my children's fathers, I'd rather them be with him than be in child welfare, because at least I know they're safe, right? I know that they're with family. I know that I would be able to contact him, and even if he hates me, he's gonna let me talk to my children. So I think when they disengage, they're doing a big disservice to the children also, because they're also breaking up family connections. I've had cases where families are like, 2 years, children got returned home, and now the child has no identity with the father side of the family. And it's like you're building a brand new relationship that should have been connected. Father side of the families do not get allowed to get visits. They have to go through hell and go through a court process as a grandparent just to get a visit at a foster care agency, when that should just be their right. If they're not respondents on the case, they should be considered resources. So yeah, I think that is a really, really big issue. And it's important that, again, fathers are a part of their children's lives. And I think the system sees it as, in their usual, Black men are not part of their children's lives, but they are in a big way. And sometimes the child welfare system wants to see things like a child support check, and I tell people all the time, growing up where I grew up, my husband is Black and has tattoos, and he's a strong Black man, and I am so proud of him. And he's always there for his children. And it doesn't always have to be that you're buying things, right? It can be just like the love, the space of being with your father, growing up knowing that dad loves you and is there for you. Like, the system doesn't acknowledge all those aspects that are important for our child's well-being.
I totally agree with her. When we had our case, it was my husband and I, and if this was separate, like let's say if we weren't together and he had the case, he probably wouldn't have our son. I'm just gonna be, and it's not because there's anything wrong with him, but the way that they treated him, as opposed to, they both treated us terribly. Even when I told him that this was my husband, the worker was like, I need to see a marriage license. And I was really offended by that. Like, why do I have to prove that I'm married? I am married. But I just to piggy, I agree with everything Jeanette was saying. Like, they don't engage with fathers at the same rate as they do moms. And it's kind of like living into the stereotype that Black girls don't get married. We don't get legally married. We don't stay together. Black parents, Black fathers are not in their kids' lives, when that is just a complete, utter lie.
Mm-hmm. Great, thank you, Imani and Jeanette. Jane, did you have anything you wanted to add on that context?
I just want to add that over the years I have represented fathers, and everything Imani and Jeanette said is true. You know, I'm thinking most recently of a young father that my program represented. They just could not believe he wanted to raise his two children on his own when their mother was unable to do it. And it was a tremendous struggle to get them to let go and just let him be a father. And so, you know, I think this is a long-standing problem, and it really comes out of what Jeanette and Imani said about our biases, about what we, you know, and our racism. So yeah, it's a huge issue.
Great. Well, I apologize. This has been such a wonderful event, but I always want to be cognizant of the amount of time that we have, and we are out of it for today. This was such a wonderful event. I'm so appreciative of Jane and Jeanette and Imani for sharing their experience, knowledge, their expertise with us. As always, we invite all of our members to reach out and contact any of our speakers. I know there are many ways that we can network together and work together to improve the opportunities for our families and children throughout the world. And these events are great and we love them, but what's really going to make differences for families and children is doing the work, right? And doing the work together and engaging in networking. So I please invite you all to do so. Finally, just a couple of plugs. If you're interested in joining the NGO Committee on the Family New York, Nadia has included the link there that you can find our website and join. Also, I wanted to announce that on December 17th, we will be having our annual Family Traditions event for the NGO Committee on the Family. At this event, we'll have a speaker talking about the importance of tradition in families and how that can tie a family together in an intergenerational way. We'll also have a more kind of personal experience of what a family tradition means for one of our members. And then we'll end with a more informal conversation and opportunity to share our own family traditions. We often do this with baking and treats, which this year we will not be able to share those treats with each other and eat like we normally do. But we've got a number of really neat opportunities to kind of share recipes using video recipes and things like that we'll be sharing. So we hope that you'll consider joining us on Thursday, the 17th of December. I hope you all have a wonderful Thanksgiving for those who celebrate. Be safe in these times. And thank you again so much for joining. And thank you, of course, again, Jane, Jeanette, and Imani for your wonderful insight. Thank you all.
Thanks.
It was a pleasure being here. Thank you for inviting us.
Thank you.
Thank you all. Thank you.
Thank you.
Great day.